Wait, stop scrolling. What if I told you that right now, in this very moment, you have access to a tool more powerful than most medications people take every single day, and it costs absolutely nothing? I'm Dr. William, and I'm about to show you something that changed the lives of thousands of people frustrated because their blood pressure medications weren't working and they felt trapped on a pharmaceutical treadmill. But before I dive in, I need you to understand something crucial about how your body actually works, because once you understand the mechanism, everything makes sense, and that's when real change happens. Your entire cardiovascular system is being controlled by something most people don't even know exists. It's called your autonomic nervous system, and it has two branches constantly competing with each other. On one side, you have the sympathetic branch. This is your fight or flight system designed to protect you. When a car swerves in front of you, when you're about to give a presentation, your sympathetic nervous system springs into action. It floods your body with stress hormones. It makes your heart pound. It constricts your blood vessels. It raises your blood pressure. This system kept our ancestors alive when running from predators, and it's still running the same program in your body today, except now the predators are your mortgage, your job stress, your health anxiety, and endless bad news on your phone. On the other side, you have the parasympathetic branch. This is your rest and digest system. This is what heals you, repairs you, brings your blood pressure down, slows your heart rate, and allows your blood vessels to relax. This system is responsible for longevity, resilience, and actually feeling good in your own body. Here's the problem I see in my practice every single day. Most people over 60, especially those dealing with chronic stress, poor sleep, sedentary lifestyles, or ongoing anxiety, their sympathetic system has become chronically dominant. Their body sits in a state of low-grade activation all the time. It's like their nervous system never fully downshifts. It's like driving with the accelerator slightly pressed down 24 hours a day. They're not in acute panic, but they're in this subtle state of tension their body has normalized. They wake up tense, they go through the day tense, they go to bed tense. Because their nervous system is stuck in this sympathetic dominant state, their blood vessels are chronically constricted, which means their blood pressure stays elevated, not because of a temporary threat, but because the nervous system has forgotten how to fully relax. They take blood pressure medications, and yes, those help, but they're only addressing part of the problem. Most medications work by reducing blood volume, dilating vessels, or reducing heart rate, but they're not addressing the root cause, an overactive sympathetic nervous system. They're not teaching your body how to activate your parasympathetic system. They're not giving you back control of your own physiology. But here's what I want you to understand. Your breathing is the only automatic bodily function with a direct connection to your conscious mind. Your heart rate, digestion, immune response, hormone production, all governed by the autonomic nervous system without your input. You can't consciously decide to slow your digestion or speed up your immune response. But your breathing, it sits at this incredible interface between automatic and voluntary. You can control your breathing. When you breathe in a specific way with a specific pattern, you're not just moving air in and out of your lungs. You're sending a direct signal through the vagus nerve, the longest nerve in your entire body, the primary communication highway of your parasympathetic system. You're sending a signal that travels directly to your brainstem, triggering a cascade of physiological changes your body cannot resist. Your arteries dilate, your heart rate slows, your blood pressure drops. The research is not fringe alternative medicine. This is real, legitimate, peer-reviewed science published in the most respected cardiovascular journals. A major review in the Journal of Human Hypertension analyzed dozens of studies on slow breathing exercises and found consistent, significant reductions in both systolic and diastolic blood pressure in hypertensive patients. The American Heart Association has formally acknowledged the evidence base for device-guided slow breathing in hypertension management. The University of Colorado conducted a randomized controlled study and found that just 5 to 10 minutes of slow, deep breathing practiced daily lowered resting systolic blood pressure by an average of 9 millimeters of mercury in middle-aged and older adults over an 8-week period. 9 points. That's equivalent to the effect of some low-dose antihypertensive medications achieved without a single pill, without side effects, without spending money at the pharmacy. A landmark study in hypertension research found that 6 weeks of daily resonance breathing reduced systolic blood pressure by 14.5 millimeters of mercury and diastolic by 6.4 millimeters. That's clinically meaningful reduction equivalent to starting a blood pressure medication. So why aren't doctors teaching this? Why isn't your doctor spending 5 minutes showing you this? There are a few reasons. First, no pharmaceutical company spends millions promoting breathing techniques. There's no profit incentive. Second, medical school trains doctors to think in pharmaceuticals and procedures. When you've been trained to think every problem requires external intervention, it's hard recognizing power in what's already inside your body. Third, it takes time to teach properly. It takes time explaining the mechanism and walking someone through practice. Most doctors run offices on schedules allowing 10 or 12 minutes per patient. You can't do this work in 10 minutes. But I'm doing it right now, teaching 3 specific techniques. Each works through a slightly different mechanism. Each has research support. Each can be learned watching this video. The first technique is diaphragmatic breathing, the foundation and prerequisite before moving to advanced techniques. Most adults, particularly older ones spending hours sitting, have drifted into shallow chest breathing. When you chest breathe, you're only using upper lung portions. You're drawing less air with each breath. Your breathing cycles are shorter. From a nervous system perspective, shallow chest breathing keeps your sympathetic nervous system subtly activated. It maintains that low-grade tension state. Diaphragmatic breathing is different. The diaphragm is a large dome-shaped muscle sitting just below your lungs, responsible for most breathing in a healthy, relaxed state. When you use your diaphragm, when you contract it and draw it downward with each inhale, you're filling lower lung portions with air, engaging much larger lung tissue volume. Here's the neurophysiological part. When your diaphragm descends, it stimulates pressure-sensitive receptors in lower lung portions called stretch receptors. These send signals directly to your brainstem, specifically to areas activating the parasympathetic response. Every time you engage your diaphragm fully, you're directly stimulating the parasympathetic nervous system. The more completely you engage that diaphragm, the stronger and more sustained that parasympathetic activation becomes. Here's exactly how to do this. Find a comfortable chair position with back support or lie down in bed. Place one hand flat on your chest. Place the other flat on your stomach, just below your rib cage. Now inhale slowly through your nose. Your goal is feeling the stomach hand rise first and more significantly than the chest hand. If your chest rises first, you're still chest breathing. If your stomach expands outward before your chest moves, your diaphragm is engaged. Most adults need a few minutes finding this coordination. Don't get frustrated. It's a skill improving with practice. Once your stomach rises consistently on each inhale, add the exhale pattern. Inhale slowly through your nose, counting silently to 4. Then exhale slowly through softly parted lips, as if gently blowing out a candle, counting to 6. The exhale is longer than the inhale. This isn't accidental. The longer exhale is more important than the longer inhale for activating parasympathetic branch. Exhalation triggers parasympathetic activation more powerfully than inhalation. When you deliberately extend the exhale, you're amplifying that parasympathetic signal, giving your vagus nerve more time engaging with each cycle. Practice 10 to 15 cycles, noticing what happens to your body. Most people feel noticeable physical relaxation within 3 to 4 minutes. Your shoulders relax. Your jaw releases tension you didn't know you held. Your breathing naturally slows and deepens. With daily practice over 2 to 4 weeks, something remarkable happens. Your resting baseline shifts. Your nervous system learns a new default state. Instead of sitting with the seesaw tipped toward sympathetic branch, your nervous system learns balancing toward parasympathetic branch. Your body learns rest as the default. This is the foundation where you start. The second technique is resonance breathing, having the strongest research base of the 3. Resonance breathing, also called coherent or cardiac coherence breathing, is based on a specific respiratory rate, approximately 5 to 6 breaths per minute. At that rate, something remarkable happens in your cardiovascular system. Your breathing cycle synchronizes with your heart rate variability rhythm, creating what physiologists call cardiovascular resonance. Let me explain heart rate variability. Your heart doesn't beat like a metronome. There's natural variation in time between heartbeats. This variation is heart rate variability, and it's a health marker. High heart rate variability associates with cardiovascular health, stress resilience, longevity, and lower blood pressure. Low heart rate variability associates with hypertension, cardiovascular risk, and accelerated blood vessel aging. When you breathe at the resonance frequency of 5 to 6 breaths per minute, your heart rate variability amplifies dramatically. The natural heartbeat variation becomes larger and more organized. It's like exercising your entire cardiovascular system regulatory capacity with every breath cycle. The research is compelling. A landmark study found that 6 weeks of daily resonance breathing reduced systolic blood pressure by 14.5 millimeters of mercury. That's a 15-point systolic drop, a result cardiologists consider strong clinical success, equivalent to starting blood pressure medication. Here's the technique. Inhale slowly through your nose, counting to 5. Make it smooth and continuous, not jerky. Then exhale through your nose or softly parted lips, counting to 5. Each complete breath cycle takes approximately 10 seconds, giving 6 breaths per minute. Breathing should be smooth, continuous, and effortless. No forceful pushing, straining, or pauses between inhale and exhale. Just smooth inhales flowing into smooth exhales continuously for 5 to 10 minutes. Many people use visual guides, free apps showing circles expanding on inhale and contracting on exhale, synchronizing breathing visually. After 2 or 3 sessions, the rhythm becomes natural. Practice resonance breathing twice daily for dramatic effect. In the morning, before checking blood pressure or email, practice 5 to 10 minutes. This establishes a calmer nervous system baseline entering the day. In the evening, practice another 5 to 10 minutes before bed. This reverses cumulative cardiovascular tension building across the day from work stress, news, screens, and frustrations. By practicing twice daily, you're telling your nervous system this is the new normal, the new calm feeling. The third technique is extended exhale breathing, the most immediately powerful for rapid blood pressure drops in acute moments. You know those moments. You're about to present. You're about to make a stressful call. You're about to enter a medical appointment. You feel tension rising. Your chest tightens. Your heart pounds. This is the technique for that moment. Extended exhale breathing works through specific vagus nerve neurology. When you exhale, your heart rate naturally slows slightly, called respiratory sinus arrhythmia, a normal phenomenon. When you inhale, heart rate increases slightly. But what if you amplified that effect? What if you extended the exhale significantly longer than the inhale? You'd amplify exhalation's heart rate slowing effect, giving the vagal brake more time engaging with each cycle. Research specifically tested different breathing ratios for producing the most acute heart rate and sympathetic nervous system reduction. They found extending the exhale to twice the inhale length produced the most powerful effect. Here's the technique. Inhale slowly through your nose for a count of 4. Then exhale very slowly through softly parted lips for a count of 8. The exhale is twice as long. If comfortable, continue. If you want extending further with increased lung capacity, do a 5-count inhale and 10-count exhale. Don't strain. Repeat this cycle for 10 breaths. Most people notice measurable change within 5 or 6 cycles. You'll notice slowing, settling, physical tension release. That's your vagus nerve responding in real time. That's your parasympathetic system engaging. That's your blood pressure dropping. I want you picking one technique and committing to practicing it for 2 weeks. Just 2 weeks? Give it that time, then check your blood pressure. You might be shocked. Comment below right now. Comment diaphragmatic, resonance, or extended for the technique you're trying. I read every comment. If someone struggles with blood pressure, share this video today. It costs nothing. The research is compelling.